carboplatin and paclitaxel is the backbone of initial ovarian cancer therapy. And the study that established that combination as the standard in ovarian cancer is the so-called GOG 258, GOG 158. And that study was published in 2003. And so, it compared carboplatin and Taxol with cisplatin and Taxol, which was the standard at that time, in a non-inferiority trial. And the carboplatin and Taxol arm of that study was found to be non-inferior according to the scientific design of the study. But it was much better than non-inferior, because if you look at the median overall survival in that study, even though it was not statistically significant because it wasn't planned scientifically to determine that, it was 57 and a half, 58 months in the carboplatin arm and about 48 months in the cisplatin arm. And in addition to that, the cisplatin and paclitaxel arm also was found to be more toxic. So you have a drug combination that appeared to be very efficacious and also to be less toxic. So it became the standard. But then if you think about it, that was 20 years ago. And since then, a lot has happened, which have been exciting in ovarian cancer therapy. We have been investigating different classes of agents for treatment. And so one class is the so-called anti-angiogenesis group. The most common in use being Bevacizumab. And then we have also looked at anti-PARP, anti-PARP enzymes, which is poly-ADP ribose polymerase enzyme, which is an enzyme that is very important for recombination of double-stranded or single-stranded DNA breaks. And this is another group of agents that we have investigated. And more recently, we have also investigated a lot Immuno-Oncology in ovarian cancer, like checkpoint inhibitors. There are a lot of studies of checkpoint inhibitors in ovarian cancer. And unfortunately, that's one group of agents that we still have not seen any impressive efficacy in. But in the last, I would say, 4 or 5 weeks, we actually have a new class of drugs which led to, or which have been approved for use in ovarian cancer, and they're called antibody-drug conjugates, where we associate, or where we tag an antibody with a very effective drug that cannot be given directly. We call it payload. And then it goes into the cancer cells and releases the payload, which will then do the job of killing the cancer cells. So a lot of developments have occurred since carboplatin and paclitaxel, and I'm happy to talk about any aspect of these developments.